Humanity is a species constantly plagued by hardship. The challenges that face us as a people are numerous and diverse in ways that some days we cannot fathom. Among the highest and most perennial of the problems that we tackle every day is public health. Half of the American populace suffers from at least one chronic health condition, and over 40% suffer from no less than two. 27 million Americans remain uninsured. That's almost 8% of our entire nation. American citizens without the capacity to gain access to good quality medical care. If you know even 13 people, one of them is likely uninsured. Likely not getting the help from their nation that they need to live a happy and healthy life. We think, as an American citizen, that we can all agree that's 1 in 13 people too many. We are, after all, the best country in the world, and, if we are to show it, we must have it applied to each and every one of our citizens. Growing up, we watched the USA produce some of the most revolutionary medical breakthroughs in the world. Hospitals, even in small, rural communities, were getting access to premium machinery. And we watched all too many primetime medical dramas that parroted out who knows how many actual medical conditions that we could be confident really did exist and look up, even if the doctors on the show didn't truly know what they were talking about. It was part of our nation's sense of personal pride that we could carry out the most complicated and experimental medical operations, which in turn would attract the most important people to our nation to seek that treatment. People would come to our medical universities from all over the world to learn what it is we had to offer. And there was trust in our medical system that it would get better and more robust as time went by. Today, that is not what we see. Instead, we see charlatans and private interests endangering the American people to maintain their fiscal agendas and retain their special privileges while, at times literally, innocent American citizens die, merely seeking the best medical services available. Tried and true methods in the hospital have been cast aside for cost-cutting updates and maximum profitability for shareholders. Our highest officials not only have no idea what the best practices for fine medical care are, but they do not care. And the American people have, as a whole, suffered because of it. We will make no statement for or against, but we believe that everyone listening can probably agree that the American people as a whole cheering on the assassination of a medical insurance CEO is the sign of an unbalanced system. We think that and that alone should be a wake-up call that something isn't working. Perhaps, in this standard, we are not the best country in the world. It is possible that our current medical system is not up to the task of managing over 340 million people ethically and equitably. Maybe there are countries that are doing it better. We know. A shocking revelation that simply cannot stand. If we're to be the best nation in the world, the almighty American Leviathan that all nations respect, the shining city on a hill, for everyone to see as an example of what civilized society looks like, then we should at least be able to take care of our common people and their ills better than anyone else, shouldn't we? Being the best means being the healthiest, the strongest, living the longest, healing the fastest, and getting back to work the most efficiently. And we can't get back to work efficiently and make lives good for everyone if people are sick and dying from preventable conditions. The fact of the matter is that many nations have found better ways about their public health care than we have. America's healthcare system is overly expensive, tedious for the patient, difficult to navigate, and has comparably poor medical healthcare outcomes compared to nations like South Korea and Japan. We, here in the New Bull Moose, are firm believers in the idea that science will bring us forth, that statistics and experimentation will get things done. The world around us has untold data that we may freely access with the flick of a finger and the push of a button. We can find the most successful systems simply by looking them up. We can find how they work and why they work the way they do. It's actually quite simple, and we'd like to think that success is a statistic by itself. If it works, and there's no reason it can't be applied elsewhere. So, once again, the new Bull Moose has solutions. Solutions that overwhelmingly look at the most successful medical systems in the world and compile the best and most successful practices among them. The healthier our people are, the more successful our nation can be. Right now, we have over 50% of our population suffering from something. And imagine how happy and fulfilled, productive and innovative they could be if we took care of them like only the best nation in the world can. Imagine how much greater America will be when half of our people are not hamstrung by conditions that we could easily treat. We've gathered together the stats and found out what makes other systems work. We've compared the best medical systems across the rankings and found what ties them together. And we think, at the end of this, you're going to either agree on what is best to do with our nation, or you'll just have to admit that you care absolutely nothing for the health of America. And that is unacceptable. That is something that the new Bull Moose cannot accept. Because the nation is sick. And if you actually care, you'll listen to best practices and the most successful systems to date. The numbers don't lie. Citizens having to leave our nation for treatment they can't access or afford here in America, being treated better in foreign soil, this is not worthy of the greatest nation, nor its people. People of other nations should come to America to seek healing, not the other way around. People should look at America as an example for what to do and not what to avoid. It is our idea that this can become possible again. That American health can, once again, become the best in the world. It is our idea that the best of all worlds can be incorporated into the American system to make sure that no American citizen ever be left sick or injured without care ever again. Such a state is unacceptable for the greatest nation in the world. We can do better. We will do better. How else are we supposed to be respected? How else are we supposed to lead the rest of the world into the golden age that we have heralded? So let's look at the facts. The strong points of the most successful medical systems in the world to date. The fact of the matter is that some countries simply do certain things in medicine better than we do. Japan manages cancer better than America. South Korea has managed to easily outstrip other nations in surgery, recovery, healing times. The Netherlands has the lowest antibiotics overuse statistics in the world, and Norway has completely smashed HIV and tuberculosis. The Netherlands, Switzerland, and Norway seem to have the highest maternal healthcare outcomes in the world. Whatever they are doing, it completely outstrips the American healthcare system in those specific fields, and we owe it to ourselves to stop acting self-righteous until we have mastered and then perfected whatever it is that they've figured out which we haven't. If it can be conclusively shown that we are not the best in a specific field of medicine, why not? Find what the best is doing and do that. It's not a terribly complex equation, and thus should be the first thing we tackle when updating and perfecting our medical system. Perhaps a good step would be to mandate extreme diversity and higher standards in medical qualifications throughout all relevant fields. By diversity in this case, we are of course referring to the requirement that even specialists have a working knowledge of nearly all fields they might be exposed to in a hospital setting. We have many people in America, and our doctors would best serve them by having the widest possible pool of medical knowledge under their belt whenever we can arrange it. The countries that enforce these skill diversity standards most strongly also seem to have the best recovery rates. South Korea specifically has shown that cultural pressure toward more doctors learning dermatology has produced considerably higher recovery rates even still. There are, simply put, matters we could improve in our medical system that other nations do better. We cannot stand for that. We are the best nation in the world. We should have the best standards in these branches of medicine. Whatever they're doing, we need to do it too. We need to do it better. So stop arguing about it and spreading Facebook conspiracy and just do what they're doing best. Next, and probably most important after just emulating the best in the world in other fields, every system we looked up among the very best medical systems in the world utilized no-fault approaches to incident investigations throughout their hospitals. What matters, so it seems, is that we figure out what went wrong without assigning blame. If someone got hurt in the medical system, that needs to be taken care of. It needs to be granted a proper and complete investigation, and if anything went wrong, understanding how to keep from doing it in the future needs to be integrated into the standard curriculum. We don't personally care who it was or how it was reacted to by the common people. All we care about in the field of medicine is that mistakes are corrected. We don't need to argue about it. We don't need to throw people under the bus and take an otherwise capable doctor out of the field. We need to get it done properly and improve on any mistakes that happen. And the best systems in the world, like Japan and Sweden, seem to have used no blame and no fault systems to greatly improve their outcomes in the fields applied. Next, we need to face the fact that the American health system is one of the most expensive in the world. Our common people value our freedoms and autonomy, so we resist new developments in medicine that we don't understand so as to preserve what freedom we feel we have. And many malicious actors have a vested interest in continuing to mislead and misinform the public with blatant lies and anti-intellectual propaganda that will encourage them to make poor health decisions against their better judgment. This all results in myriad highly expensive treatments and the propensity for the average American to wait until they are all but dying on the pavement before they'll accept help from the incoming paramedic. And that costs. It costs the individual in question, it costs for the country, it costs for the taxpayers, it costs a lot. Meanwhile, the most successful systems in the world find themselves flourishing on doctrines of preventative care to not only avoid illness in the first place, but also to save untold amounts of money on systems far better than our own. And for some of that to work, it is unfortunate to say, some things are necessary. Some things should be mandated. Average American people don't actually know anything about the highest orders of the medical field, much as some might insist they do. And many people die every year because of bad advice from people who assure them they know what they're talking about. Just as we need to become more stringent on the qualifications of our doctors, we need to become more serious about enforcing good health standards on our nation instead of allowing private corporate agendas to dominate our people's well-being. And that means some things must be mandated. That means heel prick tests for all babies. That means required wellness check-ins and testing for pregnant women. That means mandated childhood vaccines to protect our next generation. It means we actually have people who know what they're talking about controlling the health doctrine of our country, rather than some nut job who has the entire medical world screaming from the rooftops about how his decisions will kill many Americans. If we're going to make America healthy again, as the current president insists, we're going to have to take some of the decisions out of the hands of the self-important parents that know nothing about healthcare in the first place. For the safety of our children, of our country, some health options must be taken out of the hands of the common people and put into the hands of people who know what they're doing. In return, however, we're more than happy to blast all of the necessary studies and relevant statistics to literally anyone who asks. That sort of information should be more available, and questions on it more quickly answered by those who know. And it should be a foundational hallmark of our system that anyone is able to get a proper education on medical concerns at any given time. If the average person doesn't know what doctors do, if they are constantly swarmed by misinformation and anti-intellectual propaganda, then we can't ever expect to be a nation that can teach good medical science. We need to really start pumping out educators and increasing the general overall capacity to explain these things to the common person. It has been too long since anyone seemed to be able to explain what they're doing to a 5-year-old. Let's start encouraging more medical science communication from our healthcare providers and accept thereafter that they know what they're talking about when they insist that yes, you do need to get vaccinated. For the good of America. And if you actually can't get vaccinated due to a pre-existing condition or immunocompromised status, we understand. That's perfectly reasonable. But the world around you needs to know that's official. And if you get in a fucking car crash, then the paramedic scraping your pancake ass off the pavement is gonna need to know that as well. So, it should just be a thing all people get tested for, and can put on a little card they stick in their wallet, which all people can get from their primary care physician just in case they get into a horrible accident and the paramedics need a quick reference of your conditions. I'll tell you a little story on that note. We got in a car crash last year and broke our spine. In the crash, we also hit our head and could, unfortunately, not adequately explain some medical allergies we have to the paramedics. This fortunately didn't lead to any complications, but it certainly stands as a now perpetual reminder that sometimes a patient is simply not in a capable state to mention all of the important details to those assisting them, even when directly prompted. It would have been great to be able to reach into our wallet and just produce a card updated every year by our doctor that tells the EMT exactly what to know about us so they can get to moving on with more important things like stopping us from bleeding or securing our fractured vertebrae. And think of just how cheap it would be to make that standard issue in every hospital around the United States of America. It's just a little piece of plastic you put in your wallet. Safeway does it just fine. We all gotta carry around medical cards anywho. Not a big addition, and, without a doubt, something that would do hilarious amounts of good for the entire system. And how could we make this system even more streamlined, you ask? Almost every one of the best medical systems in the world, at least the ones we've studied here at the New Bull Moose, has fully integrated electronic administrative systems that completely saturate the entirety of the medical industry. Not some old-school Windows 98 systems with an internet website that all of the computers can log into via Slow Connect, but real, fully comprehensive medical databases that are easily accessible and fully manageable by those at the head of the healthcare system. While less efficient systems are opt-in, and this could be recommended for the highly individualistic American people, the fact of the matter is that our own medical industry is a slow, inefficient, and consistently user-unfriendly one that just as often wastes the time of the patient as not, and consistently runs them through poorly managed websites that fail to take care of the problems they've been made to fix. We need a full update of our medical databases, and we need to embrace the 21st century, and bring our system into the digital sphere so that it can get our people what they need faster and in a more efficient and easy-to-access fashion. And who will pay for all of this, you ask? Well, numbers being what they are, it would seem as though over half of the best healthcare systems in the world are either partially or entirely tax-funded. As it so happens, a system into which all people pay ends up being one that serves all people the best. Systems which are almost entirely funded by the people and dedicated to the people do the best for the people. Imagine that. My goodness. And most of those systems cover far more than we do in America. For example, in the best systems we could find, certain types of treatment are universally covered. Addiction support, suicide injuries, alcoholism, pregnancy-related services, and many other types of treatment are simply seen as the best and most important thing for making sure society is functioning at all. If someone is already breaking themselves on the expenses of depression, of pregnancy, of addiction, they do not need to be broken on the medical services required to treat those conditions. This will never work. There are some things we'll have to pay for as a society to help that society work better, to help everyone within it to be more healthy, happy, and productive. In the best healthcare systems in the world, it seems as though people are more than happy to pay for that sort of assistance. To say nothing of how many people we see complaining nowadays about random mentally ill homeless folk babbling nonsensically down the sidewalk all over America as though they'd be that way if they had the help they needed. With all the moaning and whining the upper-class Americans do about it, you'd think they could pay a few bucks a year to get it addressed. Single-buyer and single-pay systems seem to be common and successful basically wherever they are used. This doesn't seem controversial, despite the fact that some seem to have a problem with it. And of course, there's absolutely no reason to go entirely nationalized. The best systems take a hybrid approach to healthcare, where the private sector can be used to take pressure off the public sector. It doesn't have to be a competition, but rather a cooperation. That is how we should do it. That is how we can start to make a better system. But if we're even going to try approaching that, we have to reconsider the way we run our hospitals. The best systems in the world are not entirely privatized systems wherein hospitals compete amongst each other to see how few beds they can keep and how much money they can scoop in. The best healthcare systems in the world mandate that their hospitals be non-profits, run by physicians, and people who know what they're talking about. And the new bull moose wants nothing more than for positions to be held by people who actually know what they're doing. Clearly, our system needs hard reform. Obviously, we need a major update. And inevitably, we have come to the conclusion that such actions need to be taken for the common people, not the CEOs and billionaire business folk who have consistently shown that they cannot care for the people and their pocketbooks at the same time. This is America. This is the best country in the world, and our healthcare system needs to reflect it. It can't just be the best healthcare system in the world for the top 1%, but for every American citizen. Everyone within our borders should benefit from living in the best country in the world. And that is why everyone must vote progressive. Everyone must vote Bull Moose. Stand strong, stand together. Vote David Allen Gray for President 2028. Vote Bull Moose.